Ayurveda. Thank you, Swayambhurna. Now, coming to the topic for today's session, we from the Department of Rachana Sharira and Kriya Sharira are presenting the topic on understanding respiratory system through Ayurveda. So, we have with us the faculty from both the departments to share their knowledge. So, officially, once again, I welcome one and all to the session. Now, let me introduce the first speaker for the day. We have with us Dr. Shijin Raj, who is working as Associate Professor in the Department of Rachana Sharira, who will be giving a glimpse to the functional anatomy of upper respiratory tract. Over to you, Dr. Shijin.
To one and all. So let me just introduce myself. This is Dr. Shijin, Associate Professor, Srotas Ayurveda Medical College. Today, my presentation is on functional anatomy of upper respiratory tract. Apparently, I have to brief about the respiratory system before getting into the actual topic. So to begin with, let's find the functions of respiratory system. So the functions of respiratory system, the first function is gas exchange. So here, as we all know, the gas which is being taken inside through the nostrils and then finally reaches the alveoli which are being located in the lungs, where the actual gas exchange takes place with the blood. So the second function is defense mechanism. So here, the nose and then the pharynx and the region around the pharynx acts as a defense mechanism or the first line of defense to filter out the foreign bodies which is being inhaled. So this helps in the immune system. The third function is voice production. So here the larynx, as we all know, is a sound box or voice box where the phonation takes place with the help of the tongue. The fourth function is olfaction. So that is the sense of smell. So here the nose has special nasal mucosa which has nerve endings which can pick up the smell, that is olfaction, and take it to the brain and identify the smell. So that is the fourth function. And then the last one is humidification. So humidification is the air which is being breathed inside through the nose will be dry. So you'll have to add moisture into it so that it gets modified when it reaches the lungs for the easy absorption of the gases. So these are the functions of respiratory system. Now getting into the respiratory tract. Now the whole respiratory tract is being divided into upper respiratory tract and the lower respiratory tract. So I'll just brief about what are the contents which comes in the upper respiratory tract. So the upper respiratory tract contains the nose, then the sinuses that are paranasal sinuses, and then the pharynx and the larynx. So now the first content, nose. So you can see in the figure the nasal cavity which opens to the exterior through the nostrils. And here, when you speak, I've already told you, it acts as a filter which can trap all the foreign particles which is being inhaled through the nostrils. And then the second function, it humidifies the air which is being taken inside. And then again, it provides a sense of smell. So here in the picture, you can see the olfactory nerves like a mesh, and then it pierces inside and then reaches the olfactory bulb, which is being carried to the brain, where the whole olfactory circuit lies. Now, the second content is paranasal sinuses. So the figure you can see the paranasal sinuses. For example, the frontal sinus, ethmoid sinus. Then
Sir, I think you got disconnected.
comprises of a series of cartilages and the vocal cords. So till the vocal cords of the larynx, we call it as the upper respiratory tract. Now, when we speak about the symptoms of the upper respiratory tract during the SARS-CoV-19 infection, the first symptom is rhinitis. The second symptom is anosmia, that is loss of smell. Third is pharyngitis and associated tonsillitis. And this can even get associated with dry cough. The fourth symptom is ageusia or dysgeusia. And the fifth symptom is laryngitis. So the first symptom, anosmia or ageusia. So here, anosmia is the loss of smell, and ageusia is the loss of taste. So what happened is, during SARS-CoV infection, the viral overload in the body increases, or the viral overload in the nasal cavities increases. So what happened is, in the intranasal inoculation of SARS-CoV into the olfactory and gustatory neural circuit happens. So what happens is, the virus will just go and attach to the binding site of neurotransmitters in the neural circuits, thereby causing obstruction to the neural circuit and ultimately leading to loss of smell and loss of taste. Now, the next symptom, pharyngitis or laryngitis. So, any inflammation in the body with a foreign body, there is a release of cytokines. So, when the quantity of cytokines in the body increases, we call it as a cytokine storm, which is leading to inflammation. So, this inflammation will end up in pharynx, what we call it as a pharyngitis. And then again, when it gets inflamed in the larynx, we call it as a laryngitis. So when it gets in the pharynx, on either side of the pharynx, we have two big lymph structures called as the tonsils. So the tonsils also can apparently get infected, and this can be associated with pharyngitis. So these cytokine storm will lead to pharyngitis and laryngitis. Thank you. Session will be continued by Dr. Sajin on the lower respiratory tract. Thank you so much.
Thank you, Dr. Shijin. Now I request Dr. Sajin to present the next topic for the day, that is functional anatomy of lower respiratory tract. Dr. Sajin.
Can you see the screen? Able to see the screen?
No, it's a blank screen.
Good afternoon, all. Myself, Sachin, as professor. Are you able to see the screen, please?
No, doctor, it's not visible. We can just see a blank screen, that's all.
So I'll be doing functional anatomy, mainly the lower respiratory system.
I think Sajin got disconnected. Dr. Sajin, are you there?
Give me Wi-Fi.
Dr. Sajin?
Yeah.
Yes. Okay.
Can you see the screen?
No, can you try?
Yeah.
It's not visible. Slides are not visible. It's just a blank screen.
Yeah, I'm sharing the screen. I'm sharing the screen. Are you people able to see it?
Srinidhi, sir?
Yes, madam.
Can you able to see the shared screen?
No, sir, it is not visible.
I'm sharing the screen. Can you hear my audio?
Yes, audio is, you're audible.
Audio.
Yes.
The screen, it is not coming.
Can we go ahead without the slides, sir? Srinidhi, sir?
Yes, madam, you can do it.
Fine. Okay, fine. Okay, so I'll be dealing with functional anatomy of respiratory tract, mainly the lower respiratory tract. And coming to the clinical importance when related with the COVID-19 infections, we have to see why it is so important that we have to understand the functional anatomy of lungs and the other areas of lungs and the segments of lungs. So as is actually accurate knowledge of anatomy and physiology of the respiratory tract is important in the field of not only immunology department but also in the anesthesiology and critical care. And almost 70 to 80 percentage of the morbidity and mortality is occurring in the preoperative period. That is, it is associated with any respiratory dysfunctions. And coming to the anatomical division, respiratory tract is divided into two. That is the upper, the organs outside the thorax, that's from the nasals to the vocal cords, that's the nose and the pharynx, which Dr. Shijin have been explained in the previous session. So I'll be dealing with the lower respiratory tract, that is from the vocal cords to the alveoli. So from the vocal cords, it involves the larynx, trachea, bronchi, and the lungs. And coming to the functional divisions, the respiratory tract is divided into two. That is the conducting zones. That is nose to the terminal bronchioles. It forms a connection to the inhaled gases. And the second one is the respiratory zone. That is the respiratory bronchioles to the alveoli, where the gas exchange takes place. Now, coming to the organization of the respiratory system, it is divided into two. One is a structural organization and another is a functional organization. So in the structural organization, it is divided into two, upper respiratory tract and the lower respiratory tract. So in the upper respiratory tract, we have the nose, nasal cavity, pharynx, larynx. Then from below the larynx, it starts the lower respiratory tract. That is a trachea, the bronchioles, the terminal bronchioles, and all the parts in all the structures which we can see in the lungs consist of the lower respiratory tract. So coming to the functional organization, the conducting zone and the respiratory zone are the two parts of functional organization, in which the conducting zone is having the nose, nasal cavity, pharynx, larynx, trachea, bronchus, the bronchioles, the terminal bronchioles. But the other part, which is actually the respiratory bronchioles, the alveolar duct, and the alveoli, that is involved in the respiratory zone. So all other part is involved in the conducting zone, and only the respiratory bronchiole, alveolar duct, and alveoli is involved in the respiratory zone. So the major part, when a person gets a COVID-19 infections, you can see the maximum cases of maximum infected areas will be in the lungs. And the main symptoms what we see is a ground glass opacities in all the lobes, especially in the lower lobes. It will be more when we compare to the viral pneumonias and the bacterial pneumonias. The attack will be more in the lower lobes, but it is also on the ground glass opacities on the lobe and also in the lower lobes. So this is the importance why dealing with the functional anatomy of lungs. We have to understand where and all these infections happens. So I have put one diagram, but if someone can see it, it is easy to understand. And coming to the larynx, that is a voice box. We all know this production of sound and its role in it helps in the breathing, cough reflex, and it has got a protective function. But this laryngeal region, there are infections in certain larynx near the cricoid cartilage regions, the inner aspects of larynx, in interior lining of the larynx. There are spot infections, and we call it as the pit box infections in the larynx due to this COVID. And the hoarseness of sound may appear in some patients because of this. And you can see the vocal cords in the diagram. So some people have the hoarseness of voice, which is developed due to the infections of the COVID. And coming from the larynx to the tracheobronchial tree, there is a trachea, the first part of the lower respiratory tract. It is a hollow tubular structure having 11 centimeter in length and 1.5 centimeter in diameter. And it's permanently opened by C-shaped cartilages on its walls that are the two main or the primary bronchi, and each primary bronchus divides into secondary bronchi, that is 3 on the right side and on the left side. Tree, that is each secondary bronchus divides to 4 tertiary bronchi. On the right side we have and 8 on the left side, and the bronchi also have cartilage plates in their walls to keep them patent. The tertiary bronchi divide from the terminal bronchioles having the diameter 1 millimeter, and the terminal bronchioles divide Okay. Then coming to the tracheobronchial tree, that each respiratory bronchiole divides to form 5 to 6 alveolar ducts, and the alveolar ducts opens into the dilated sacs called the alveolar sacs. And each alveolar sac is studded with pouches called alveoli. So these are the main regions where the when an infection occurs, COVID-19 infection occurs. These are the main areas which are affected. Then coming to the alveoli, which is structural and the functional unit of the lungs, that is it consists of approximately 300 million alveoli. And the total surface area of alveoli of both lungs is 70 square meters. And alveoli is lined by simple squamous epithelium. And there are two types of epithelial cells which is present. That is of 19 that's only 5%. So coming to the next slide, we have another important which can be seen inside the lens. So the fourth column is seen in the right alveoli, and these are structures in the alveolar system which allow the communication of adjacent alveoli. So the size of these depends on different size, and in humans it is 0.8 to 50 micrograms. Here, I'm sorry, it is keep on getting disconnected. Okay. So one thing I want to tell is why these children are not getting that much affected with the COVID-19, and it's not going to get that much serious as the old people, because the pores of corn is not that much developed in small children. So the effect it is like a channel which connects the two alveoli together. So there is no, it's a poorly developed in children. So that is why, that is one of the reasons that the children are not get that much affected due to this COVID-19. Then you can see that pores of corns in a pulmonary alveoli. I have put one diagram for you people to see, but I don't know why it is not being shared. Okay, fine. So coming to the another one important aspect is that the right lung is more commonly affected by the inhaled foreign bodies. And the right main bronchus has a wider diameter, that is the main reason, and is shorter in length and lies more vertically relative to the hilum when compared to the left main bronchus. So the aspirated foreign objects are more likely to settle in the right bronchus, and you can see the CT scans and X-rays that more patients are more getting affected in the right lungs. And it is advised, if you are getting infected in the right lungs, you have to turn to the right side and you have to adjust your positions so that the maximum the lungs can get ventilation. So the another one is a Webel's model, that is Webel's numbered each generation of tracheobronchial tree, that is from trachea to alveoli. There are 23 generations of divisions, and up to terminal bronchioles there are 16 generations. And this part is called as the conducting zones or the anatomical dead space. This is what I have told in the first slide about the conducting zones and about what all areas are coming in the conducting zones. And from the 17 to 23 generations, from the respiratory bronchioles to the alveoli, is called the respiratory zone or physiological unit of a lungs. So these 70 to 23 generations, that is the respiratory bronchioles to the alveoli, are the main regions of infections in COVID. Then coming to the tracheobronchial tree, that one diagram I have put here to show the 23 generations of tracheobronchial tree coming from the trachea, bronchi, bronchioles, terminal bronchioles, respiratory bronchioles, alveolar ducts, alveolar sacs. So there is like a table like from 1 to 23. In each sections, the alveoli is going tracheobronchial alveolar division. It is going to be divided. So if someone can see the screen, means it will be easy to understand. Then coming to the segments of lungs. Segment of lungs is very important because we have the lungs into two lungs, the right lung and the left lung. In the right lung, you have the right upper lobe, then you have the right middle lobe, then you have the right lower lobes, total 3 lobes. And the left side of the lungs, you have 2 lobes, that is a left upper lobe and the left lower lobe. Again, this lungs is going to get divided into different segments. That is why this is so important to understand where and all the COVID-19 virus is going to infect in your lungs. So from the right upper lobe, again there are 3 segments. That is the apical segment, anterior segment, and the posterior segment. And in the right middle, you have a medial segment and a lateral segment. And in the right lower lobe, you have the superior segment, anterior basal segment, medial basal segment, posterior basal segment, and a lateral basal segment. And coming to the left upper lobe, that is the lungs, left lung, you have the apical, a posterior, a anterior, superior lingula, and an inferior lingula. And finally, the left lower lobe contains a superior, anterior basal, medial basal, posterior basal, and a lateral basal segments. So we have all these group of segments in which it is divided into different segments of almost 20 segments. And from these 20 segments, when we take a CT or a screening CT to find the severity score, you can find out in each segments which all segments the infections happens or the scars happen or events is happening, and you can grade it according to points in a system called the Corad's CT severity score, or like another grading for the COVID-19. It is called the Corad's screening, like it is from 1 to 5. The other physicians in the pathology department will explain more about that. So I'm not going into that section. So this is important to understand how the grading or how the pathology of the lungs will happen. First, you have to understand the lobes of the lungs and all the segments of the lungs, and in each part of the segments, how much there is infection is happening or how much areas there is a lesion due to this COVID-19. And according to it, if a set of scores are made, it is like out of 25, how much areas are affected, and in otherwise, in total of 40, how much it will be infected, which all segments are infected or which all areas are infected. According to that, there will be scoring. So next is a diagram, that is I'm just showing a normal lung X-ray diagram, how a person had been before infecting with the COVID-19 infection, and after. If anyone can see, that will be good. Then this is a 30-year-old female having the X-ray on the 7th day. So how much you can see the ground glass opacities in the middle upper lobe and also in the lower lobes, and how it got worsened till the 12th day. It is almost completely covering the lungs. Only a little area above in the upper lobe is visible in this X-ray film. Okay. And coming to the next part is a pleura. That is, its lung is covered by a double-layered serous membrane called pleura. Why I am telling is that there are so many complications are happening related with the pleura after a COVID-19 attack. So that is why I am dealing with this pleura. It is a layer that is closely covering the lung, and it is divided into 2 types. That is a visceral pleura and the parietal pleura. And the layer that is reflected back at the root of the lung and onto the surface of the diaphragm and the thoracic cage is called the parietal pleura. And the space between these 2 layers, that is a pleural space which is filled with a pleural fluid. So approximately we have 2 ml of pleural fluid, and mainly the function of the pleural fluid is that to keep the layers together, and it acts as a lubricant between these 2 layers. And if a patient is going to be ventilated, or a mechanical ventilation is supported by patient, or if he is continuously for more than 7 days due to a COVID infections, there is a chance for a pleural effusion, that is like accumulation of significant quantity of fluid in the pleural cavities. We call it as pleural effusion. And another one complications which is common ventilated patient who is under the NIV, or it can be due to any other infections or any viral pneumonia or bacterial pneumonia also can lead to a pneumothorax. So that is what I want to tell about COVID-19 and related with the functional anatomy of the lungs and the lower respiratory tract. So the next session will be dealt with Ayurvedic related with Ayurvedic COVID and all those things will be dealt by Dr. Ramita. Thank you for the session.
Hello. Yeah. Can you see my screen? First slide.
Yes, it is visible.
Now that we have heard the modern aspect of both upper and lower respiratory tract, let's take a look at what Ayurveda offers us. So Ayurveda has or famously known as the Indian system of medicine, have always stood the test of time. May it be the cure for simple fever, or cure for more grave or serious conditions like multiple sclerosis or AD. If it is treated by a good Vaidya, it has always given results. And Ayurveda is it's passed on through generation. It's almost more than 5,000 years old, and it's passed on through generations through a system called as Gurukula way of teaching. So what is this Ayurveda, or why is there so much fuss or so much noise about Ayurveda in recent days or during this pandemic? Ayurveda is famously known as the science of life. So has anyone given a thought as to why it is called so? When we go to the definition of Ayurveda, you come across the description that Ayusho Veda. So it's merely translated into as the science of life. But what is it actually? Why is it called so? Why is it called as the science of life? So if you dwell deeper into the science of Ayurveda, you get to know that it teaches us the art of living, or the ways to maintain uh, good health through different methods like dinacharya or ritucharya. So it has described various regimens which can be followed by a person in order to maintain good health. And this is not for an adult. It specifically, or it Ayurveda in detail, it explains various rituals or regimens that has to be followed by an individual right from the time of conception till death. So that is why this is called as the science of Ayurveda, because it preaches or it teaches us the act of living. It has given, or it has varied knowledge about how to or what to eat, what not to eat, and different viharas, like what to do and what should be avoided, and when you should go to sleep, when you shouldn't sleep. So these are all different things we can adopt into our life. It's not that difficult, and it doesn't cause any side effects also. You just have to modify your lifestyle. So why this is important at this COVID pandemic, at the time of this pandemic, is that if you go through many journal papers, you will see that how China, they combated the pandemic, or how they successfully controlled the pandemic. So they claim that they adopted the Chinese medicine in order to tackle the various conditions, or they treated their people with Chinese medicine. So why some set of medicines are working on some people and some are not? So a person, if you take a person for example, he will be habituated to a particular area. So if you put him to some extreme conditions, then his body will act differently, or his body will try to adapt or try to acclimatize to the new environment at the cost of his own body. So Ayurveda being or coming from a base that is India itself, our body is more nurtured, or it is more easy to maintain our life or the health, or to cure the diseases which are seen in the Indian Peninsula region with the help of Ayurveda. And also, it's not only the curative aspect. Ayurveda has a powerful lineage of very effective preventive measures to tackle maybe non-communicable diseases or communicable diseases, and even pandemics. So, isn't it always better to prevent the onset of a disease rather than to cure it? So, that is why we need to accept and adopt Ayurveda in our lives, especially during this pandemic. It has taught us that it's always better to live a healthy life rather than to keep on taking medicine and compromising our immunity. Now, the concept of human body, what does Ayurveda tell us? So, in Ayurveda, we come across with a term called as Sharira. So, Sharira is what can be related to the human body. So, we get the definition of Sharira as Shiryate Anena iti Shariram. So, something that which undergoes continuous degeneration or destruction or degradation can be called as Sharira. So, if you take into consideration from the time of conception, the ova and the sperm, it Shukra or the Artava, it fuses together and it give rise to the Garbha. And from that moment onwards, that cell or the single cell ova, it is getting converted to a 2 cell, then 3 cell, 4 cell. So like that, there is a continuous transformation of what we call as the ovum. So this transformation, that itself gives us a hint towards the changes that are taking place in our body. So some cells are dying and it is being replaced by some other cells. And if we take a look at the level of organization, even in Ayurveda, it says that the smallest unit is the paramanu. So these paramanus, they combine together to become a macromolecule. Then the macromolecules, it becomes cells. Then many cells, they combine together to form the tissues, or what we call as the dhatus. Then dhatus together, they reside in an ashaya or the organs. Then many organs and the circulatory channels collectively, they come to form, or they constitute the various systems in our body. So here you can see a image, different images of how the organs or the viscera are organized inside our body, and you can also visualize the numerous muscles. So this is what makes the human body unique. Now coming to today's point of interest, that is the Srotas. So what are Srotas? Okay, so these Srotas, we know that we eat the food and it is being digested in the stomach, and then it is carried by the various circulatory channels to its target of action. So this is the same structures which can be related to as in Ayurveda, that is Srotas, which can be called as the various orifices or circulatory channels. So these are not merely a structural entity, but you have to consider the functional aspects also. Together with the functional aspect, only you can understand the Srotas. So Srotas are innumerable in our body. That is why Acharyas have called it as Shariram Shrotomayatvam. That is, our body is made up of numerous Srotas or numerous channels. So one might think, when we can count the number of vessels, how can you say that there are the Srotas are innumerable? For that, Acharya himself, he clarifies saying that there are some Srotas which are visible to the naked eye, whereas there are some others which are very tiny and cannot be viewed with the naked eye. So those can be, so if you look into the modern aspect, you can see that there are tiny junctions between the cell wherein the exchange takes place. So they are also actually channels wherein some substances are being moved from one cell to the other. So basically what I'm trying to say here is Srotas are structures which can be found in every cells also. Okay, so it can be found in every cell, and this helps in transporting various nutrients, both the posture, that is the nutrients, as well as the dhatus which are undergoing the transformation. Okay, and this is spread all over the body. So you can correlate this Srotas into microscopic and macroscopic channels of circulation. So here any channels for that matter. So if you take the respiratory system for that matter, so if you take alveoli, the lung alveoli, so lung alveoli also, there is some sort of exchange that is taking place. The basic definition of Srotas itself says Sravanat Srotamsi. So the channels wherein Sravana is taking place or oozing out is taking place, such structures can be called as Srotas. So what do you understand by oozing? Oozing could be the exchange of substances also between two structures. Like an example would be diffusion. Okay, so this basically it acts as a pathway for dhatus, okay, for carrying the dhatus that is under transformation, and the posharasa, that is the nutrients which supports the or which nourishes the dhatus, thus maintaining the balance. Now coming to the respiratory system in Ayurveda, it can be correlated to the pranavaha srotas. Now, why only to pranavaha srotas? Why not other srotas? So, in Ayurveda, we have 9 bahirmukha srotas, that is the openings which open to the external environment, and there are 13 antarmukha srotas, that is the channels which doesn't open to the external environment. So these 9 orifices are your nose, the 2 nostrils, the oral cavity, the 2 openings of the eyes, ears, then the urethral opening, anal opening, and the vaginal opening. So those are the bahirmukha srotas. Now, out of the 13, why we are considering pranavaha srotas here is, this srotas, it carries the prana. Now, what is prana? Prana, the meaning of prana, it is given by different acharyas. Some quote that it is just the prana vayu. So prana vayu is accepted by the contemporary authors as the oxygen or something that which gives us energy or life. Okay, without oxygen, you very well, most of you would have experienced, if you stay in a closed room for a long time, you will feel lethargic and there is loss of strength, and some people might feel or even fall unconscious. So these are all because of the depleted oxygen level in your blood. Oxygen is that is mainly because oxygen is required by the neurons or is required by the brain to stay alert. Okay, some other authors opine that this prana can be the dwadasha prana also. So that is all the components which are responsible for maintaining your energy or maintaining your life force is can be included under the prana. They are the dwadasha prana, which are Agni, Soma, Vayu, Sattva, Raja, Tama, and Panchamahabhutas. So all these, that is the dwadasha pranas, can be understood under the under this prana. Now, Sharangadhara, who is a later author, Sharangadhara, who has written Sharangadhara Samhita, he gives a detailed explanation regarding the mechanism of respiration. So he quotes that prana is actually present in the nabhi. So why nabhi would have been quoted? So I told you that Ayurveda describes life right from the time of conception. So during the intrauterine life, it is through the nabhi that the baby is getting its first prana, or the first life source is through the nabhi. So that could be one reason. Another reason is nabhi is the one which is acting on during a active respiration. That is when the diaphragm is pulled down, that is when you inhale, your diaphragm is pulled down and your abdomen inflates so as to accommodate the inflating lungs. So during that time, the nabhi, the movement is observed at the nabhi. We call it as the thoraco-abdominal respiration. So he quotes that prana that is present in the nabhi, it comes out through the kantha and enters through the nasa. So, and he also quotes that this is being conveyed to all parts of the body through the rasa. Okay, so rasa also plays a very important role in conveying the prana, or this life force, or what the contemporaries think as the oxygen to the target sites. So every Srotas is explained in terms of Moola. So the Moola can be understood in different ways. Moola can be the organ of origin, or the organ that controls that particular Srotas, or where the symptoms are manifested. So here I have divided the Moola into two. One is the main organ that controls the Pranavaha Srotas, and the other is Sanchara Sthana or Vyakta. So here, in the context of Hridaya, as I told you, here we have to consider the lungs and the heart as a collective unit, taking it as a cardiopulmonary pump. So only then the Srotas, that is the Pranavaha Srotas, the channel is getting completed. Next, coming to the Rasavaha Dhamani and Mahasrotas. So the Rasavaha Dhamanis can be understood as the various circulatory channels which carries this prana to different parts of your body. And Mahasrotas is the koshta, which acharyas quote as Sharira Madhyam Mahanimnaha. It is a large cavity which is present in the center of the body. So here we can take it as the thoraco-abdominal cavity, which is evidently taking part in the act of respiration. All the muscles as well as the organs of the thoracic cavity have to function symbiotically in order to carry out the act of respiration. So now coming to the Nidana of Pranavaha Sroto Dushti. So as I told, these are different circulatory channels, and these channels can also be vitiated. Now, what are the causes for the vitiation of these Srotas? So in Charaka Samhita, we get a reference quoting that when a person indulges in ahara and vihara, with ahara and vihara having the same quality of dosha. Say for example, vata is having shita guna. If the person is consuming too much of ice creams or too much of cold water, then there is a chance that he'll get that particular dosha dushti. In case of Srotas, what he says is, if he consumes the opposite quality of the dhatu, that is, for example, a person, he consumes too much of ruksha ahara, in such a person, then there will be medova sroto dushti will be there. So that is how the sroto dushti takes place. And whenever there is a sroto dushti, it will invariably end up in dhatu dushti, and when it starts with a dhatu dushti, it will invariably end in the sroto dushti. Now, the specific nidanas for pranavaha sroto dushti, first one is listed as the dhatukshaya. Dhatukshaya, again, severe emaciation or wasting of the body when it is there, it will lead to vata vriddhi. So even according to modern concept also, if you see, when there is excessive, very severe emaciation, it can lead to ketoacidosis, and in such cases you can see Kussmaul's breathing. Next causative factor is vega dharana. Vega are our urges. Okay, dharana means suppression. So when you suppress your natural urges, it will create some imbalance in the body. So which all vegas cause direct pranava srota dushti are kasa. When you try to suppress your cough, or you suppress your belching, that is udgara, you try to suppress your jirimba, pipasa, kshuda, then it can cause the pranavaha sroto dushti. So when you see, you have to understand these urges as it is actually a sign of your body telling you that, see, there is some trouble in your git, or there is some difficulty in your throat or in your blood, that it is trying to tell you. See, when you cough, it shows that there is some disturbance in your throat, so you cough and try to expel that organism or that foreign body out. Okay, belching, that is, you're trying to remove the excessive gaseous formation that has been accumulated in your stomach. Jrimba, yawning, it clearly shows that your brain is getting less oxygen and your body is tired. Go and take some rest. Pipasa, that is, there is some fluid imbalance, you need to have more and more fluid, so please drink. And Shuddha, your glucose level is dropping, you need to eat something right away. So what happens when you try to suppress all these? It's definitely the body will try to take from the reserves, and that is how emaciation sets in. Then ruksha ahara vihara. Again, I told you, any dry food or dry environment can cause the sroto dushti. Then shuditasya vyayama or ati vyayama, excessive exercise wherein there is loss of fluid is there, loss of salt, electrolytes are there, and you are exerting too much. You are putting more pressure on your lungs to take in more oxygen or to breathe heavily. Then anya daruna karma, it means that any other unlawful activities, that is your unlawful activities that you involve yourself in, that can harm your body. So all these can cause pranavaha srotas dushti. Other diseases, specific diseases of pranavaha srotas are shwasa, that is rapid breathing or difficulty in breathing. Then kasa, that is cough, rajayakshma, pratishyaya, swarabeda, urakshata, or these pranavaha srotas, the various lakshanas or symptoms can be seen as secondary manifestations in case of various other diseases like Pandu, Raktapitta and all. So that is about the Nidana and glimpse about the Pranavaha Srotas in Ayurveda. Further, the Lakshanas and the Dushti Chikitsa and all will be dealt by the subsequent speakers. So I would like to conclude my session by saying that you have to follow the science of life, that is Ayurveda, to stay healthy, and know and understand your Sharira or Prakriti and make the necessary modifications, develop and comply. Just developing won't do. You have to follow a healthy routine and diet. Avoid all the nidanas to maintain the health of your systems. Most of the times, even though we know that this is going to harm my body, still we do that, because that is where the chanchalata of mind comes into place. Then in the end, always stay positive and have good thoughts. That's always the mantra to lead a healthy life. Thank you. With this, I conclude my session, and next point will be taken up by Dr. Nimisha. Thank you.
Good afternoon, everybody. So till now, Ramita ma'am have given us a brief idea about pranamaha srotas. What are the mulasthanas? What will happen if you? What are the causes for the vitiation of pranamaha srotas and all? Now let's discuss about how you will get to know that pranamaha srotas is not functioning properly, or how you will understand, or what are the symptoms your body is going to show indicating improper functioning of pranamaha srotas. So that's what we are going to discuss under this topic of pranavaha sroto dushti lakshana. Lakshana refers to the symptoms or signs, and dushti in the sense if there is some vitiation or abnormalcy in the pranavaha srotas, or if our srotas is not properly functioning, so it will be showing some symptoms. Body will be showing some signs, or give us some signs or symptoms saying that my this particular srotas or my this particular system is not functioning well. So let's see what are those lakshanas.
Ma'am, your screen is not visible.
I'll share once again.
Okay.
Is it visible, ma'am, now? Is it visible? Is it visible now?
No, ma'am, it is not visible.
Srinidhi sir, can you share your screen then? Sir, have you shared?
Not yet.
Okay. I can't see the PPT.
Wait, I'll try once.
Okay, ma'am.
Is it visible?
Not
Srinidhi
yet.
sir? Ma'am, is it visible to you?
Not for me, ma'am.
Ma'am, 1 minute, ma'am. It's not visible. Screen is not visible, ma'am.
Mother.
Screen share ಮಾಡಬೇಕು. Stop share ಮಾಡಬೇಕು.
Ramita ma'am, I could see the screen just now.
ಪ್ರಾಣವಾಯು ಸೋತಸ್ ಬಂದಿದೆ.
Madam, it is visible now.
Okay. Nimsha ma'am, you can continue. I'll change the slides.
I can't see the slide, but
you can continue.
Okay.
Can you?
Yeah, I can continue.
Okay.
So let's start with the general Sroto Dushti Lakshanas. For all the Srotas, there are some general symptoms mentioned in our classics to indicate their abnormal functioning. So we'll start with the first Lakshana. That is, first one is Sangha. Sangha refers to some kind of obstruction. So as we all know, this oxygen is coming inside our body and carbon dioxide is being thrown out of the body through a series of tubes or through a set of tubes, what we call as our airways. So if there is any obstruction in the airways, this proper distribution of or exchange of oxygen and carbon dioxide won't be happening. There are so many causes for this obstruction, just like if there is so much secretion of mucus, what we call as our phlegm, or if there is some kind of obstruction in the airway because of the presence of some kind of foreign bodies. Again, if there is some inflammation because of all these things. So all these reasons will ultimately end up in causing some kind of obstruction in the airway, which will end up in improper distribution of the gases. Again, second point discussed in the Lakshana is Ati Pravrti. Ati Pravrti means excess functioning of something. That is, if our particular respiratory system is functioning excessively, that is, if the person is inhaling and exhaling abnormally more than what is required, or we can take it as abnormal increased movement of the muscles involved in respiration, or if there is more secretion of mucus. So all these things we can consider as ati pravrti or excess functioning of this respiratory system or a pranavaha srotas. The third point here is vimarga gamana. That is, the oxygen and carbon dioxide are destined to reach particular places. Oxygen, ultimate aim of oxygen is it should be distributed among the tissues for the proper functioning. So what happens is there, because of some kind of obstruction and all, the oxygen and carbon dioxide won't end up in their proper destination. They will take a wrong turn, or they will deviate from its normal direction. Just like when we drive with our GPS, we'll take wrong routes and end up somewhere. So just like that, air will leave its normal path and end up somewhere, which is again causing some kind of abnormalcy in our body. Fourth point here is Sira Granthi. We can consider this as some kind of abnormalcy in our blood vessels. So this oxygen and carbon dioxide is getting distributed in our body through the blood. Blood is the supplier for all these oxygen and carbon dioxide. So if there is any abnormalcy in the blood vessels, the proper distribution of blood won't be happening. In turn, oxygen and carbon dioxide won't get delivered properly to its places. So ultimately, the blood vessels, if they are abnormal or any derangement in the blood vessels is there, the distribution of oxygen and carbon dioxide is again getting affected. So these are the four general lakshanas what are being mentioned for our general Srotodushti lakshanas. That is, one is obstruction, second one is excess functioning, third one is taking wrong directions, and fourth one is abnormalcy in the blood vessels. So now let's see the particular lakshanas what are being mentioned for pranavaha srotas, especially by our classics. First, there are a few lakshanas mentioned by Acharya Charaka. Let's see that first. First lakshana mentioned is Ati Srishtam. Ati Srishtam means your respiration or breathing pattern will be too much extended or prolonged respiratory pattern we will be experiencing. We'll see the details later. And second one is Ati Baddham. Baddha refers to some kind of restriction or obstruction in your breathing. So the respiration will be a restricted form. Kupitam, some kind of vitiation. We can take it as pain or severe breathing difficulty and all. Fourth one is Alpa. You will be breathing, but that breathing will be with interruptions. Interrupted breathing pattern. And next is Abhikshanam. Abhikshanam, we can take it as there will be a continuous breathing difficulty. The person will be having frequent breathings, but again, there will be severe difficulty in that. Next is Sashabdam. The person will be breathing, but again, it will be associated with some kind of sounds. Just like commonly when we say the people who are having asthma and all, they will be having the wheezing. When they have the attack, they will be having a particular sound when they breathe. Again, next one is Sashulam. Shulam refers to pain. So whenever they breathe, they will be having pain, or it will be a kind of severe painful breathing. There are few more lakshanas what has been mentioned in other classics. That is, first one is unconsciousness. The person will even lose his consciousness. Second one is tremors. Tremors in the sense the person will be having uncontrolled contractions of the muscles, or uncontrollable kind of shivering of the entire body or particular part of the body. Third one is distension of abdomen. The person will be having the feeling of something is filled in my tummy kind of thing. And the person will experience vomiting, fever, delirium. Delirium in the sense the person will be in a totally confused state. He will be misinterpreting things. He'll be misjudging things. He can't understand it in the proper sense. He will be out of his consciousness. And finally, again, different types of pains. So these are the general lakshanas or general symptoms what are being exhibited by our pranava Srotas if there is some abnormality. Now let's see a bit of the explanation for these lakshanas. First one is atisrishtam. Atisrishtam, as we said, it is prolonged breathing. So we can consider this prolonged breathing as it can be taken as there will be increased rate and force of respiration. You have to put more effort and the rate and force will be more in breathing. Otherwise, we can consider this as increased mucus secretion also. So we experience this kind of breathing in normal cases also. That is particularly this abnormally rapid kind of breathing we will experience when a person is particularly nervous about something. For example, when we are about to give an interview, when we are about to see our exam results and all, along with our increased heart rate, there will be a kind of rapid breathing. Our breathing pattern suddenly changes. So that abnormally rapid breathing we can consider as atisrishtam. Also, we have experienced this deep sighing respiration in the sense the person will be having a deep inspiration and a deep expiration. Something what we normally do when we are in a state of disappointment or when we are too much sad or we have expected to get something, instead of that the outcome have gone entirely different. Or sometimes when we are relieved from some big thing. So in all these cases, we normally experience a deep inspiration and expiration. Particularly what we have to stress here is the force what we are giving will be more. So even this kind of breathing is seen abnormally in neurological disorders and all. And sometimes we experience this kind of increased breathing rate normally after doing some severe workouts, strenuous exercises and all. Also, in cases of hyperventilation, that is, if you're exhaling more than what you inhale, if you are breathing out more than what you are breathing in. So in this case also, the rate and force of breathing will be more. Some cases what happens is the breathing will be starting very slowly. Inspiration and expiration will be occurring in a very slow manner, and after some time the rate will be very rapid. The person will be having a deep inhalation and exhalations, and in between there will be a pause. What other people might not even notice. Only that person will be having that particular feeling of in between breathless kind of thing. So all these kinds of different breathing patterns, we can consider it as the increased rate and force of respiration. Also, sometimes there will be increased mucus secretion. One thing what we have to note here is we have to take care of the consistency and color of the sputum what is being spitted out. Sometimes it will be watery, sometimes it will be too much mucoid, sometimes it will be having particular foul smell, so some particular color will be there. So all these things should be taken care and should be conveyed properly, because all these things will be affecting the diagnosis and then the treatment also. So the next point what we have to discuss here is abhikshanam, a restricted kind of breathing. So what happens here is in case of increased breathing rate or where the depth of breathing is more, particularly when the person is exhaling more than what he is inhaling, or when he have undergone so much severe exercises, or sometimes we can even we all get that feeling after climbing a series of flight of stairs. If we climb or if we are running for a short while, rather than normal, we have a discomfort. We might not have experienced that discomfort previously, but suddenly all of a sudden I'm feeling it uncomfortable to climb the stairs. I can't walk this much distance and all. So in that conditions and all, we experience that particular kind of panting, deep and rapid kind of breathing. The person will be facing that deep and rapid kind of breathing. But important thing here is that respiratory rate will be increased, but not the force. The person will always have the feeling of shortness of breath. So the person try to inhale and exhale more and more rapidly. The person will be having the sensation of I'm not having enough kind of air here, which makes him breathe at a faster rate. The rate of breathing will be more and more here. That is about abhikshanam. And next one is atibaddha. Baddha refers to some kind of obstructed breathing. So what happens here is, sometimes this happens voluntarily also, particularly in case of hyperventilation, when the person is exhaling more than what he inhaled. He, at a particular moment, he feel that shortness of breath, or there will be a pause in between the inhalation and exhalation. Shortage of air kind of feeling will be there in that particular moment. This will happen in other conditions, like when we normally eat and talk, or when we talk while eating or laugh while eating, the food goes into the respiratory tract, and for a particular moment, the person feel breathless. Otherwise, in conditions like inflammation of the tonsils and adenoids also, there will be some kind of obstruction in the airway because of this, because of which the person will be having difficulty in breathing. This kind of breathing pattern is also seen in premature babies when they cry for a long time and all. Sometimes there will be a short pause in between their breathing pattern, which will be regained later on. So this kind of difficulty in breathing, where there will be a passage for the air. So that is what we call as atibaddham. Next one is alpa-alpam. Alpa-alpam means we can consider this as short episodes of breathing or shallow breathing. This occurs particularly when there is muscular weakness. As we discussed before also, there are so many muscles involved, or the contraction and relaxation of these muscles are the ones which help the person to inhale and exhale. There are so many muscles around the chest, neck, shoulder region and back region and all, which helps in a person to inhale and exhale. So they control this amount of air in and out. So if these muscles are weak, or if these muscles go weak, the particular amount of air what you are going to breathe in and out will be less. That's what we call as shallow respiration. This also occurs in conditions like hypoventilation, where the person is inhaling and exhaling less than normally. Normally, in a particular time, that is for in 1 minute, the person is supposed to breathe, inhale and exhale 12 to 16 times. Less than this, we consider it as hypoventilation. And next point is sashulam. Shulam refers to pain. So the person will be having pain while breathing. So pain in particular regions, particularly in the chest region, and what kind of pain you are experiencing, even that need to be taken care. And where this particular pain is seen, it is seen only in a particular region, whether it is localized type of pain, or the pain starts in this region and it extends to somewhere, what we call as the radiating pain, whether the pain is only in the chest region, or sometimes it radiates to the axilla region, or it goes to the shoulder region. All these things need to be taken care properly and conveyed. And this pain a person experiences normally when he breathes, also when he coughs. So when is the pain exactly? When the person is inhaling or exhaling, or when the person is coughing? So all those things need to be considered here. So next point is sashabdam. So when the person breathes, it will be associated with some kind of sound, as we discussed before. People who are prone to asthma and all, when they breathe or when they have this attack, they will be having a particularly high-pitched whistling sound, what we call as wheezing. So normally this occurs when this airway is too much narrow. Airway is not wide enough for the flow of proper airflow. So this might be because of some kind of inflammation, excess mucus secretion, or the muscle spasm, muscles on the airways have undergone some injury and all. So all these things will lead to the narrowing of the airways, which will give the person so much strain in breathing. Again, this shabda can be associated with our cough also. So we can relate this shabda to our cough also. So what type of cough the person is going to experience, whether it is dry cough or how much duration this cough is persisting, whether it is only for a short duration, whether it is a repetitive type of cough, or whether the person is having pain while coughing, or whether it is just a dry cough, or it was initially dry but later he started getting sputum when he is coughing, what we call as our productive cough. So all these different types of cough or the nature of cough also need to be considered here, or we have to take care of what type of cough the person is experiencing. So all these points we can discuss under the heading of sashabdam. Ultimately, the person will be struggling to breathe. Kupitam, the last point, what is there in the Lakshana is Kupitam, which means all the points what we have discussed before, we can consider all those points under this heading of Kupitam, some kind of vitiation or some kind of discomforts. We can call this also as uncomfortable awareness of respiratory effort. Normally, all of us are breathing and we are not aware that we are inhaling or we are taking in air and giving out of air and all. But here in this case, what happens is the person will be very much aware that I'm breathing in and breathing out. The person will either feel some kind of pain, or he will feel so much of strain while breathing, or he will feel that shortage of breath and all. So all these different kinds of symptoms are mentioned under this heading of Pranamaha Shroto Dushti Lakshana. One or the other symptoms are present means we have to understand that our Pranamaha Shrotas is not functioning normally. What we need to get corrected. So there is nothing to, we can't ignore these symptoms, but it can be managed with simple techniques. How this can be managed, or how can we keep ourselves healthy, or how can we keep our respiratory system healthy, will be discussed next. So this topic will be discussed next by Preti ma'am. So that's all to discuss under this heading of Pranamaha Shrotas. Thank you. Over to Dr. Preti ma'am.
Thank you, Nimisha ma'am. Hope I'm audible to all. So I'm sharing the screen now. You can see the screen.
Yes, it's visible.
The screen. Yes.
Yes, ma'am, it's visible.
Okay. So, okay. Okay. So we have already discussed about the Nidana or causative factors and the symptoms which is occurring because of the Dushti of Pranavaha Srotas. Now let us see the general measures what we can adopt to keep the Pranavaha Srotas in a healthy state. So when we discussed about the causative factors, most of the factors like suppression of natural urges, ati vyayama or excessive exercise, or when we are hungry and taking other exercise things or something like that. So all these are related to improper lifestyle and improper food intake. So what we have to do is we have to avoid the general causative factors which will cause the vitiation of the Pranavaha Srotas. So we all know the knowledge of the causative factor is very much helpful for planning the treatment. And if we are continuously having contact with these causative factors, this will lead to the disease, and the disease will keep on worsening with time. So we have to just adopt a proper lifestyle and diet. So how to improve the function is, as I told, we have to adopt a proper lifestyle and healthy diet. So let us see what kind of lifestyle modification we can do to improve the physiology of Pranavaha Srotas. So we can do the daily regimens, which is called as Dinacharya, and also the seasonal regimens, Ritucharya, and proper sleep also along with that. The good contact is very much helpful to improve the physiology of Pranavaha Srotas. So Dinacharya, first we will see. Dinacharyas means the regimens which we are adopting from morning, which means when we will wake up till night. So all the regimens I'm not explaining here, the regimens which will be helpful to improve the physiology of pranava srotas are one is gandusha. Gandusha means holding the liquid in the mouth, and kavala means the same thing, but here we do the pulling of the liquid inside the mouth. And the third one is nasya, which is nasal medications, and the fourth one is dhumapana, inhalation of medicated smoke or fumes. So these are the measures which we can adopt under the daily regimen to improve the physiology of pranavaha srotas. So in that, gandusha means, as we already discussed, it is keeping the liquid inside the mouth, and kavala is just moving the or pulling the oil or medicated liquid inside the mouth. So what we can use to do gandusha and kavala is we can just use warm water which is mixed with haridra, that means turmeric powder, and normal salt. Instead of that, we can use normal sesame oil also for doing the kavala and gandusha. So what is the importance of doing this gandusha or kavala is it will improve the hygiene of our oral cavity, and along with that it also help us to fight against the microbes which are entering inside the body, or even to the pranava srotas through the oral cavity. So what in our home we can do is just we can use the warm water which is mixed with turmeric powder and normal salt, and the normal sesame oil also can be used to do the kavala and gandusha. So the next point is nasya. Nasya means it is a panchakarma therapy, and here what we will do is we will administer the medicated oil through the nostril, and this also will help to cleanse the sinuses, nasal passages, and it also will help to improve the lubrication in the nose. So this is also a technique to improve the condition of the pranavaha srotas, because the upper respiratory tract is the entry point to the pranavaha srotas. So nasal medication also will be helpful. So for this, what we can use is simple sesame oil or anutaila can be used, which is proven that it is having antimicrobial and anti biotic activity in this, so that we can increase the function of our upper respiratory tract. So here we can use normal sesame oil or anutaila for improving the function of the pranavaha srotas. So next point is dhumapana. Dhumapana is the inhalation of the medicated smoke through mouth or through nose, or vice versa, according to the condition of the disease. So if this is normally used for the disease which is affecting the upper part of the body, mainly head and neck region, so the medications like haridra, gugulu, or pipili can be used to make the dhuma netra, and that can be ignited with using grita or thaila as the medium, and the smoke can be inhaled through nose and can be exhaled through mouth, or vice versa, according to the condition. This also will be helpful for the healthy condition of the upper respiratory tract. So this will cleanse the nasal passage and sinuses also, same as that of nasya karma or nasal medication. So next is fumigation. Fumigation means the same medication, like it is recently proven that usually when we will use the fumigation, it is having antimicrobial and antifungal activity. So the fumigation, if we are doing in a house or if it is in a hospital also, it will protect us from the microbes which is attacking us. So it is also proven as antimicrobial and antifungal. So next point is steam inhalation. Steam inhalation, it is usually it will be helpful to give the proper condition of the upper respiratory tract. If any blockage is there, or if any bronchoconstriction, nasal congestion is there, the steam inhalation will be very helpful. So we can use normal water also, or in that we can just put the tulsi leaves, or we can use the karpuravalli leaves into the water, and if we are inhaling the steam, it will open the upper respiratory tract. Mainly it will remove the congestion which is present in the nasal path, and it will give a relief if the person is affected with any congestion of the nose or upper respiratory tract. So next is about the Vyayama. So in the causative factor, we have explained if we are doing Ati Vyayama, it will cause the Pranavaha Sroto Dushti. So Vyayama, how we have to do it is, the one person should do the Vyayama in a medium way. That means half of its strength is explained by Acharya. The person should do the Vyayama half of its strength. That means when the person is doing Vyayama or exercise, if the perspiration is occurring, he should stop the exercise at that time. So if the person is doing the exercise in proper manner, it will give strength and firmness to the body. And if he's doing it in excess, that will damage the body. So we have to do the Vyayama in proper way. That means Ardha Shakti Vyayama we have to do in usually in Vasanta Rutu and Hemanta and Shishira Rutu. So Alpa Matra Vyayama and Ardha Shakti Vyayama we have to practice. So next is about the Ritucharya. So Ritucharya means by knowing the strength of the person, the Ritucharya is mainly divided into Adana Kala and Visarga Kala. So in Adana Kala, the strength will be less, and in Visarga Kala, the strength will be comparatively more. So by the strength of the person is enhanced by knowing the suitable diet or regimen which is to be followed in that particular season, and the person should follow that diet and regimen accordingly. So if the person is following the same, the strength or the Agni or the daily working capacity of the person can be improved if the person is following the Ritucharya. So the next slide is about the Satvita. So we have already explained the lifestyle modification, what and all we have to do, the daily regimen we have to take care, and the Ritucharya and all the medications or therapies which is explained in Dinacharyas can be followed to improve the physiology. Along with that, some ethical regimens are also there to improve the physiology. So first one is good social conduct, good personal conduct, then good moral and religious conduct. So in this nowadays in this pandemic situation, we know we have to maintain the social distancing, or we have to use the mask. So all this will be coming under the ethical regimen. So according to Acharya, the ethical regimen in that will come under that always we have to tell the truth, we have to respect others, we have to maintain the personal hygiene, don't spit in the common space. So all these will be coming under the ethical regimen. So along with the lifestyle modification, we have to follow the ethical regimen or Sadvrita to maintain the physiology of or the functional aspect of the Pranavaha Srotas. So this is coming under the lifestyle modification. Next, we will move on to the diet, which we have to follow. So here mainly we are discussing about the dietary guidelines for consuming the food. So usually we know what type of food we have to eat, but most of us don't know how to eat. So that is considered as ahara vidhi vidhanam. Ahara vidhi vidhanam, the rules to take the food. So one should take the prepared food which is hot in nature, so that the digestion will be improved if the food is hot, and all basal metabolic temperature will be maintained. So for that, the food should be hot while intaking. So snigdha ahara we have to take, balanced diet, and one should take the food only after the proper digestion of the previous food. And we have to avoid the viruddha ahara, and we have to take the food in good surroundings and using proper utensil, because the bad surroundings will create an aversion towards the food. So we have to take it in good surroundings. The food should not be taken too fast, and it should not be taken too slow. So why we are telling it should not be taken too fast means the appreciation, that means what kind of food we are taking, or the rasa or the color of the food, nothing can be appreciated if we are taking the food too fast, and the digestion also won't be proper, because the time which is taken for the mastication or chewing, it won't be enough if we are taking the food too fast. And too slow means the person won't get the satiety, and also if we are taking the foods too slow, there is a chance of overeating also will be there. And the next point is we have to take the food with utmost attention without talking and laughing. Now most of us will take the food in front of TV or using mobile phones. So that also will hamper. So according to Chakrapani, he told that even though if we are taking the normal diet or a wholesome diet in proper time, if it is affected by krodha or shoka, chinta, the food won't properly digested and it won't be useful to the body. So we have to take the food by paying due regard to oneself, and all these measures should be followed while intake of food. So first point, I have already explained that hot food we have to take. So pranava srotas when we are talking about, so if there is ama condition, that means indigestion is there in the beginning, we can take the medicated hot water which is medicated with ginger or jeera, so that water can also be used to improve the digestion. So this is about the ahara vidhi. So next is about nidra or proper sleep. So we know nidra idam sugam dukam. So that means if we are sleeping enough, that means at proper time, if we are sleeping and the person is getting the proper time according to the age, some time limitations are there for sleeping. So if the person is sleeping the enough time, if it is there, that will give sukha, pushti, bala, then vrishata. That means it will give happiness, nourishment and strength to the body, and the person will feel so fresh, so that the jnana, that means the knowledge what he have gained, he should have that cognitive function, so that whatever he has learned he can recall and he can reproduce that. So that is about the nidra. So this is the time taken for different age groups, how many hours he should sleep. That is this slide is showing. So next we will move on to the yogic practice which we have to do. So yogic practice, we know the Ashtanga Yoga, Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyana, Samadhi. So all these Ashtanga Yogas, from starting from Yama, Ahimsa, Satya, so all the Sadvrita or ethical conduct he has mentioned. And in the second, Shaujam, Sandosham. So Shauja means it is cleanliness. So both physical and mental hygiene he has already discussed in yogic textbook also. So this will come under the Sadvrita, and also the hygiene, mental hygiene and physical hygiene, which is told by our Acharya. So the yogic practice like asanas and pranayamas also will be helpful to improve the physiology of pranava srotas. So the recent studies have already proven that if Nadi Shuddhi Pranayama, if we are doing for at least minimum of 3 months, it will improve the vital capacity of the lungs. So this will also help the healthy situation condition of the Pranavaha Srotas. So next is Jalaneti. So this is also mentioned in yogic text. So Jalaneti means it is application of salt water through one nostril, and it will be coming through the other nostril. This also will cleanse the respiratory passage, mainly the nostril if congestion is there. So this also will help to improve the physiology of the pranavaha srotas. So next is, if we are doing all these measures, that means healthy lifestyle and proper diet, if everything is there and the person is very dull and he's not of having positive sense or positive thinking, then all these things will be of no use. So along with a healthy body, the person should have a healthy mind, then only he will be finally a healthy body will be there. So think positively and keep eat healthy and keep your mind active and learn new things and do the exercise regularly and follow the dinacharya, ritucharya, and sleep properly. All these things will finally give a healthy body. So next is some herbs which is related to the pranava srota. So Ashtanga Hridaya Vakadacharya has explained Surasadigana and Vidaryadigana. It will be helpful for the pranava srotas. And when we are mainly discussing about the Shwasa Chikitsa, the Shotan and Shamana Chikitsa can be adopted. And these are the common drugs which will be few common drugs which we can use to improve the function. So one is Tulasi. Tulsi Swarsa can be used, and this is Karpuravalli. For steam inhalation, we can use the leaves of this plant, and we can put it in the pan water which is boiling, and we can use that steam for inhalation. This will reduce the congestion of the nasal passage, and the turmeric milk can also be used to improve the function. And with medical supervision, we can use Charnaprasham or Dashamola Kadutrayan Kashayam, Thalisavatradi Churnam, or Kushmanda Rasayanam. All medications also can be used for Shwasa Chikitsa by taking a reference from the physician. So these are the measures which will improve the physiology of Pranavaha Srotas regarding to the lifestyle and diet modification. So coming to the conclusion, so following the lifestyle which is described by ancient Indian medicine is highly effective in reducing the lifestyle disorders. So one should first, what we have to do is we have to avoid the causative factors which is causing all these diseases, not with respect to Pranavaha Srotas only, all the Srotas, if it is getting vitiated, what we have to do is avoid the causative factors and lead a healthy life by following the Dinacharya, Ritucharya, and proper sleep, diet, everything. So this is the concluding part. So thank you all for the patient listening.
Good evening, one and all. Hereby, we have come to an end of today's webinar on the topic of understanding respiratory system through Ayurveda. On behalf of Department of Rachana Sharira and Kriya Sharira, I would like to take this opportunity to thank our respected Director Sir, the President of VAP Karnataka Chapter, Dr. B.R. Ramakrishna Sir, our beloved Principal and General Secretary VAP Karnataka, Dr. Raghuram Bhatta Sir, and all other members of VAP Karnataka Chapter for letting us share the knowledge of our science Ayurveda to the public on this occasion of Ayurveda Day celebration. I would also like to thank all the audience, including our students from all the platforms, for their active participation. We couldn't have successfully completed this session without the constant support of our dear colleagues. So a warm and special thanks to our Shushruta family. Thank you once again for joining us. Thank you one and all.
Srinidhi sir, shall we end the session?